Hello everyone, this is Dr. Vyshnavi, your ENT faculty on the PrepLadder platform, and today I'm here to teach you about otosclerosis, and with the help of this animated video you're going to understand it even more easier. So let us understand what happens basically in normal hearing. So basically the sound travels from the external ear, external auditory canal, and hits the tympanic membrane. Now when the tympanic membrane vibrates, the vibrations are carried to the ossicles, the malleus, followed by the incus, and this is followed by the stapes. Now, all the three ossicles will cause vibration of the stapes, causing movement in the scala vestibuli, from where the vibrations are transmitted to the scala tympani, and the scala tympani, which is covered by the round window, will also move. So this is how normally the sound reaches the inner ear. From the cochlea or the inner ear, the sound now travels to the cochlear nerve to the brain. Now what happens in otosclerosis? There you see excessive deposition of bone at the foot plate of stapes, resulting in non-movement or reduced movement of the foot plate of the stapes. So the sound vibrations go from the external auditory canal, hit the tympanic membrane, go to malleus incus, but unfortunately the stapes is fixed, resulting in decreased mobility or non-mobility of the stapes, resulting in no sound transmission or reduced transmission of the sound to the inner ear, resulting in hearing loss. Now, any pathology from the pinna to the footplate of stapes will result in a conductive type of hearing loss. So, here in otosclerosis also you will see a conductive type of hearing loss. So, I hope you understood this video with the help of animation in a very quick way, in a very short time. I'm hoping that you're going to definitely recollect this entire video in understanding otosclerosis when you're studying it with me in my sessions. Hope to see you again, and do not forget to like, share and subscribe and comment in the section below if you're liking these videos, to have more such videos so that we can get to you on a regular basis. Take care and bye-bye.